some Coke and drink some Mentos and see what happens.
Drink Mentos. Oh, you've seen when they combine these? That's... Oh, this is not good.
Oh, I really don't feel good, guys. Look how bloated I am right now. I can't breathe. I think I feel
Oh, no.
I think I...
Oh, we're in for it today.
How do you put on a shirt, bro? No disrespect. No disrespect talking, bro. I stretch it out. I go this way. Oh.
Be careful. Don't dislodge it.
Nothing, just put on my shirt.
So this young gentleman has got an external fixator. That's what that is. At some point recently, he must have broken the bones of his jaw, and this metal bar then connects those bones that are broken to keep them together so that they heal together. At some point after the bones are healed, you remove that external fixator in a surgery, and he should heal hopefully really well. Getting to know what these used to feel like on someone's face. Breast augmentation is the most popular operation that I perform, and so every day I see patients who are feeling their implants and their family members feel the implants too. Sometimes even the kids grab them because they think they're kind of fun to squeeze. That being said, I've never had a patient or their significant other take the implants and stick them on their face, although it's not a bad idea. So she's a nurse, and the inside of the vagina is made of what? I mean, mucosa. The same flesh as the inside of your cheek. Is this true? Well, the answer is, it is actually true. They're both composed of mucosa, and we have different mucosal surfaces, like the inside of the mouth, like the inside of the private parts. Even the inside of the eyelid is a certain type of mucosal surface. Believe it or not, doctors have actually taken the oral mucosa, the mucosa on the inside of the mouth, and used that to actually reconstruct the vagina. Oh, he's got a probe inside somebody's ear, and he's pulling something out. What does that look like? Oh, I know what that is. I hear that these are getting stuck in people's ears all the time now. There it goes. It's like the end of like an AirPod or some type of wireless headphones. This is not good. Be very careful when you're sticking these in your ears. Make sure they fit your ears perfectly, because I'm hearing from ENTs all around that they're having to perform this treatment on a lot of people. Oh. Oh. No, no, no. This is, oh, no. Oh, I mean, it looks good, but oh. This is called a hyaluron pen, and what this does is it utilizes pressured air to push filler into somebody's lips like this. The problem with this treatment is it can be very, very dangerous. Because you don't have control over where you're pushing that product into, if it goes into a blood vessel, it could literally kill the lip. The lip can turn black, it can die, and it can fall off, and you can have literally no lip. So apparently the story is that this guy got frostbite on his hands, and it was so severe that it caused dry gangrene. Dry gangrene is a term used to describe when parts of your body literally die because of loss of blood flow. And when you get frostbite that's so severe, the cold is so intense, you don't get enough blood supply to those fingers, they can die, they turn black like this, and the treatment is to amputate them. So she had a chemical peel. Now chemical peels can come in all different types. Some of them are so mild that you don't really get a whole lot of flaking like this at all. And others, your skin can peel off like you're a snake, and that can take a week or two to happen. The key when you're healing from a chemical peel is you don't want to aggressively peel that skin off. The skin underneath it is healing, and if you try peeling it off, you can actually cause scarring, and it can even result in infections. Wow. Oh my gosh, those are some lifts. Wow. Have you ever seen lips this big before? So let's break down what I think they may have had done. You can see there's a suture line at the top of the lip and at the bottom of the lip, and most likely that means that the person underwent a lip advancement operation. But this will leave a scar, and that's why I'm not a huge fan of this type of an operation. And most likely there was some type of substance injected into lips, either filler or fat. If the lips are this huge because of recent injections of fat, a good amount of that fat will go away. Anywhere from 80 to 90% can actually disappear. If it's filler, well, now you just have to wait. Oh, this is raw meat. Oh. There are many pathogens that you can get from raw meat, like E. coli, and there are even parasites that you can get that can cause worms to grow in your digestive tract. So please stay away from raw meat, especially raw chicken. Now this is beef, it's not quite as dangerous as raw chicken. Oh. Now this occurs when you tear your biceps and then they retract proximally, which means towards the body. Unfortunately, the only treatment for this is surgery. So be careful when you're working out, use good form, and don't use more weight than you can handle.
This is a work of art.
So do you think she may have breast implants? Well, she looks fantastic, and if she's happy with her body, then all the more power to her. As somebody who performs upwards of 50 to 100 breast augmentations a year, I think it's important to realize though that the bigger the implants, the heavier they are, and the faster they will droop with time. So I usually recommend to my patients, pick the smallest implant that you know you'll be happy with, because that's gonna last you hopefully the longest. So she's cutting a bit of tape, showing you how to do something here. She's showing you how to lift your breast using tape. Here we go. Now obviously you want to put the tape onto your skin, not onto your shirt. She's showing it so that she doesn't get bleeped out, obviously. There you go, it's an upside down Y. And here's how they look. This is a nice little hack, but you want to make sure that you don't have a sensitivity to the adhesive of the tape. Now, breast lift surgery is not for everybody. It creates a lot of scars that typically extend all the way around the areola, down and underneath. And so for those people who don't want to have surgery, well, I guess you could try this.
I got an ice cream cone stuck in my mouth.
Is she crying? Is she crying? Okay, I think if that was me, I would just bite down really, really hard and then start eating that ice cream. Wouldn't you? Well, that was a lot of fun. Let's watch and react to more TikTok videos by hitting the playlist right up here. And if you've been enjoying my videos, please subscribe to my channel, and always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.